you have a stethoscope?
I told my parents from the time I was 3 that I was going to be a doctor. I used to say a baby heart doctor. My name's Jordan Noble. I'm a pediatric cardiology fellow here at VCU. So when I was 3 years old, I got diagnosed with congenital heart disease, which at the time they thought was likely genetic. After my initial diagnosis hit 3, I saw a pediatric cardiologist every 6 months to a year from then on out. And as I got older, I was really interested in understanding my heart disease, understanding what was normal and what was abnormal, and actually had the privilege of shadowing my own pediatric cardiologist when I was in high school.
Hi.
I was transitioning from pediatric to adult congenital cardiology, and they did a baseline cardiac MRI and found that my aorta was much larger than they thought it was based on echo. So at that point, I was told it was time for surgery. Within the next month, it was scheduled and done. And so when I was 20, I had open heart surgery. And it was really an interesting experience because I had it at an adult hospital. So I stayed in the hospital for 5 days post-operatively. And then unfortunately, I had a complication and ended up being admitted multiple times between my sophomore and junior year of college.
And I want you to just breathe normally, okay? Now take some nice big breaths.
Definitely after I had my heart surgery and I got to experience all the wonderful people that went into that and see what that looked like, I really decided that I was for sure going to do medicine. But at that point, I wasn't entirely sure what flavor of medicine I would be choosing. So once I was in my 3rd year clinical rotations in medical school, I decided on pediatrics. And if you had asked me when I started pediatrics residency if I was going to be a cardiologist, I would have told you absolutely not. I liked it. But once I got into my pediatric cardiology rotation in residency, it just completely changed my mind within the first 2 hours of being there. I got to see a patient with cyanotic congenital heart disease that I had not previously understood very well. And the attending cardiologist was asking me questions about how I would expect the physics and the physiology behind this patient's heart to work. And it just intuitively made sense to me, which was very surprising. And ultimately at the end, I was like, wow, you can really use logic and reason to figure out what's going to happen. And all of it just makes sense.
I was talking with Jordan, our fellow, and we think the next time we need to see you is a whole year from now.
As a fellow, I'm trying to get a comprehensive training so that I can be a well-rounded pediatric cardiologist when I'm done, particularly on the bad days where I'm really struggling and I feel like nothing that I do is right. I remember all of the things that the fellows and that the cardiologists did for me and how highly I viewed them, and think about how much of a privilege it is to be able to take care of these patients and their families. I get to take care of some of the sickest patients in the hospital every day, and they're some of the most resilient kids that I know.